Sexually transmitted infections. You just get used to STDs and they go and change it to STIs. Your book talks about a variety of STIs, but the ones you need to know about are the ones that interfere with fertility and reproduction. The first of these is the human papilloma virus, responsible for genital warts, and other strains are linked to cervical cancer. A pap smear developed by Dr. George Papanicolaou is a painless procedure involving swabbing some of the cells sloughed off from the uterus and then examined. Cells with constricted nuclei, like those on the left, are normal. The dilated nuclei, like those on the right, have been infected with the HPV and is an early indicator for cervical cancer. The vaccine approved in 2006 protects against strains of HPV responsible for 70% of all cervical cancers. The vaccine does not cure an infected person, so the need to distribute the vaccines to young women before they become sexually active has raised ethical concerns. Is the delivery of this vaccine giving underage girls permission to have sex? There are no established tests males can undergo for the presence of HPV. Next, chlamydia. This bacterial infection is believed to be the most common STI in North America. In most cases, people with the disease are asymptomatic, and is likely the reason why it's so prevalent. Oddly, twice as many women as men are affected. And, if left untreated, the infection can spread to the cervix and oviducts and lead to pelvic inflammatory disease, or PID. PID is painful and can lead to scar tissue in the oviducts, causing them to block, making her infertile. A baby who comes into contact with chlamydia during childbirth can develop infections of the eyes and respiratory tract. The cure for this bacterial infection, if caught early enough, is a series of antibiotics. Lastly is gonorrhea, not far behind chlamydia for its prevalence in North America, and its effects are similar, except it affects more men than women. Gonorrhea can also present as asymptomatic in about 20% of the cases. However, the first clue for the infection is the painful urination. PID, as before, can result in scar tissue in the oviducts and infertility. Also, the infection can get into the bloodstream and to the joints, heart, and brain. Typically, immediately after birth, the physician or midwife would apply antibiotic cream to the eyes of the newborn. In many places, this is done prophylactically because it was at one time a major cause of blindness in newborns. Some institutions still use silver nitrate, one of the first antibiotics from the 1800s. Again, this bacterial infection is cured if caught early enough by an administration of antibiotics. This is the rate of chlamydia infections in Alberta in 2004. The picture in the background is an electron micrograph of an infected cell. This is the rate of gonorrhea infections in Alberta in 2004. The picture in the background is an electron micrograph of the bacteria. Preventing STIs, then, will rely on males usually, but even females as well, enforcing the use of condoms. They reduce the risk. Personal responsibility, not engaging in activities that would impair self-control, such as alcohol use. Long-term monogamous relationships reduces the incidence of STIs, and of course abstinence will prevent the transmission of any STIs. Abstinence, of course, is no sexual activity at all.